Afternoon, and thank you for spending the next hour with us. I'm Shannon Ginther, Chair of the Columbus Women's Commission. As we explore strategies to advance equity in the workplace. We've missed being able to connect in person with you over the past few months, and though that doesn't mean that the work has stopped for you or for us. Conversations like this are more important now than ever. Our nation and our world are at a crossroads as we experience a global pandemic and a national movement to advance racial justice. What I would like to offer to each of us today is to think about the question, what can I do? These events have created a time in history where we can all make progress toward equity and justice. What can we do individually and collectively in our community to advance equity? From where you are, the seat you're in professionally, roles that you have in the community, your role in your family and with your colleagues. As employers, you have an unprecedented opportunity to establish your companies as gender and racially equitable. Doing this right will have positive impacts on recruitment, retention, and engagement. Our new series, Navigating COVID-19 with the Gender Lens, was created to help our adopters do just that. The Columbus Women's Commission is absolutely rooted in advancing opportunities for women, women's economic security, and looking at this work from both a racial and a gender lens. We value each of you in our community. It is now my honor to introduce Barb Smoot, Commissioner and Chair of the Gender Equity in the Workplace Committee. Barb has been an incredible leader in our work, and she will moderate our panel this afternoon. Thank you, Barb.
Good afternoon, everyone. First Lady Ginther, thank you for that wonderful introduction to help us kick off today's webinar. We are grateful to have three outstanding business leaders with us today to discuss navigating COVID-19 with a gender lens, workplace policies and strategies for gender equity. This is our first webinar in our summer webinar series. Before we get started, we'd like to make sure that everyone listening in today is familiar with the key aspects of the Columbus Commitment, which is our community's Pay Equity Pledge. Over 260 company CEOs have signed the commitment, promising to act in 4 areas. Learn about the economic impact of pay inequity, analyze internal practices that may contribute to disparity, invest in implementing solutions, and share best practices. Today's session will help shed light in many of these areas. We know that you may have questions throughout today's session, and please use the chat function to send us your questions. And Shelley Biding, the Executive Director for the Columbus Women's Commission, will help us get to as many of them as possible. We have with us today Gail King, Ola Snow, and Heather Whalen. We will begin with a quick round robin and have each panelist introduce herself, her company, and her role. Ladies, after you introduce yourselves, please respond to the question of what unique problems you think women, and especially women of color, have faced during the COVID-19 pandemic in the workplace. Let's go and kick it off with Heather Whalen, please.
Thanks, Barb. So my name is Heather Whalen. I am the CEO of Gail Communication. We are Central Ohio's largest independent PR agency. I'm also the chair of the board for the Women's Fund of Central Ohio. So I find myself spending a lot of time focusing on these issues impacting women and girls. I'm thankful for you and the Women's Commission hosting this panel and glad to be part of it. I think we know from the research that women are being disproportionately impacted by COVID-19. At Gail, our team is about 27 people, and the vast majority of my employees are women, interestingly. And we've seen COVID impact in a few ways. I think first is childcare, trying to balance work and homeschooling when school is in session, and then now balancing work and some form of daycare at home can be a strain for parents. We've seen the impact of just life events. We've had a number of employees who have had to delay their weddings, reschedule honeymoons, navigate. We have 2 people on our team who are pregnant. Their husbands haven't been able to go with them to the doctor's appointments. Those are all stressful events normally in a normal time, and then adding the anxiety of COVID on top of that is adding another layer of uncertainty and anxiety. And then the other one that's a little harder to maybe articulate exactly, but is sort of grounded in the idea of economic uncertainty. I think at the beginning of COVID, there was just so much question about how the economy would respond. and for us, how our clients will respond. Thankfully for us in a pandemic, companies have an increased need to communicate. So our clients have hung with us and our business is fine. We've tried to be as transparent as possible with our team about revenue and cash flow and other financial metrics, which I think they appreciate. But I think that the other flip side of that is it's created questions when they are working for employers who are not being as transparent. It raises questions around what are they hiding? Why aren't they sharing as much information with us when they look at their friends or their partners and are worried about their economic well-being?
Thank you, Heather. Gail King, if you could take it next, please, that would be wonderful.
Sounds great. Thank you. I'm excited to be here today, and I also want to just commend the Women's Commission for their continued great work in this space as we work together to really change those numbers in terms of how women and women of color are treated in the workplace. But I'm Gail King. I'm the Chief Administrative Officer at Nationwide, and in my portfolio, I have responsibility for human resources. Very much like Heather, as I think about how COVID has impacted women in general, I think it's the lack of separation of home and work. I think she spoke to that. And I think it's the natural stress and anxiety of, worrying about whether you or your children or spouse may become ill. And then because women are often hired into roles that are impacted by what's happening in the economy, I think that job loss is of a natural fear as well. But as it relates to women of color, that is compounded because we know that while women make 81 to 82 cents on the dollar, we know that women of color primarily earn 62 cents on the dollar. And then when you listen to, the natural fears of, hey, how do I take care of my family during this time? But the fact that they are making less, they're generally employed in roles in which there's a high likelihood that they may be unemployed. And then many of them are also employed in roles that are deemed essential. And as such, they have to show up at work and they're concerned about their own health and well-being. So again, I think some of the issues that we've been facing as it relates to women in general and women in color, doubly, is just totally compounded by COVID.
Thank you, Gail. And last and certainly not least, we have Ola Snow from Cardinal Health.
Thank you, Barb. And again, just my appreciation for us coming together and talk about these really important issues. Ola Snow, I'm the Chief Human Resources Officer at Cardinal Health. I also have responsibility for real estate and facilities as well as environmental health and safety. So got a lot of people to talk about and things to do. But I think Heather and Gail talked about really all of the issues that are facing women. But if you think about this pandemic, it is just shining a bright light on the ugly truth of the inequity that goes on between women and women of color. So when you think about both in, as Gail said, the risk of unemployment and then those essential workers, think about this. About 70% of our healthcare workers that are going into clinical settings are women. And so not only are women being faced with economic risk, but they're also being faced with the risk of going in and then having to come home every day, take care of their kids, school their kids. So I think this issue is just even more evident that we have a problem when it comes to this in our country, and that this COVID has just really shown that light of those inequalities and equities even more.
Thank you, Ola. What I'd like to do now is transition over to Gail. Gail, I understand that Nationwide has thousands of employees located in multiple locations. Given a workforce of that size, what resources have you utilized to ensure Nationwide's culture stayed intact while everyone was working remotely? And I believe the lion's share of these individuals were working remotely.
They are. I think, so one of the things that we believe in wholeheartedly is that the more you inform and communicate with your associates, the better you are able to understand what's on their minds and to bring them along. So starting in January, when COVID was beginning to be talked about, we immediately moved into frequent communications with our leaders and our associates across the country. So probably we've been on a weekly cadence with our associates for the since January. And we did that because we needed to ensure that we were giving them as much information as we had, and that we provided an opportunity for them to give us feedback on what was causing them some concern. So our big deal on that is that, digital was one of these things that everyone talked about, but what we were able to do because of some huge investments we've made in our technology is that we were immediately able to move 98.5% of our associates to working from home. And that was all of our associates, even our call center associates. We had less than 1,000 people coming into the office during that period of time when there was so much uncertainty. So again, we leverage communications, communicate, and we leverage technology. The CEO, myself, and all of the senior leadership team, at least once a week or once every 2 weeks, we would host a meeting with every associate about COVID-19 to ask them, how are they feeling? What do they need to know? As it related to our culture, we just did a lot of things that we've always done. We just did it virtually. So we stood up leadership forums. So once a week, once every 2 weeks, we do a leadership forum to help leaders manage through a remote environment. For people who work from home, we do sessions for them. We set up mindfulness sessions. We provide all kinds of resources to them. So what you had to do is you had to say, how do you put more structure around the things you want to do? And how do you keep people connected to the larger organization, even though they're working from home? And it has, we've leveraged pulse surveys. So in addition to communicating, we're constantly taking pulse surveys to find out how people are feeling, about everything. So again, it's just staying close to them and allowing them to tell us how they're feeling about everything.
Thank you, Gail. Ola, we just heard Gail say that about 98.5% of her workforce was able to be transitioned to a work from home environment. We understand that Cardinal Health has a large portion of employees that could not work remotely. What did you do to support these employees?
Thanks, Barb. When you think about it, we had about over 20,000 employees that actually had to keep coming to work. Now, like Gail, our call center employees, our ops execs, everyone that was absolutely not critical to actually manufacturing and distributing life-saving healthcare products, we sent home. But that still left about 20,000 of our employees that actually make and distribute these on a daily basis. So very early on, we put some guiding principles or some milestones out there of how we would make decisions. And so first and foremost, the safety of our employees while servicing healthcare was the two things that we made every bit decisions around. So from there, a theme that I think you'll hear throughout this webcast is communication. We did not make a decision without our chief medical officer. So even though I was put in charge of the crisis team, I made those decisions with a healthcare provider. And we really use not only podcasts and webinars, but our chief medical officer has spoken to thousands of frontline employees. Because again, it's about not only keeping that employee safe at home, but keeping their families safe throughout this pandemic too. We know that, temperature taking, contact tracing, personal protection equipment was so vital to keeping our employees safe, but we know that they had to go home. We know they had to go to the grocery store. So keeping their families and themselves safe outside. And we did that through everything from sending PPE home at times to a lot of education, not just for our employees, but for their families as well. We obviously help think about their total well-being, and we'll talk about that a little later on. But we thought not only financial help to those employees, but making sure that they had emergency daycare, childcare, elder care to make their lives absolutely as seamless as possible so that they could feel confident and supported in this pandemic.
Thank you, Ola. One quick follow-up question. I believe at one point Cardinal Health had some international operations.
We do. So Gail talked about January. We actually faced this pandemic in Asia and Europe with our employee population. So that was a great opportunity for us to learn very, very early on. Now, while we don't have operations like a plant in China, we do have a lot of commercial employees that go out and sell. We also have plants through Thailand and other parts of Asia. So we brought a lot of that information back as we made decisions. We sent folks home pretty early, as Gail did in March, knowing that this was coming. We put all of our stress tests on our systems as we needed to, but we took a very conservative approach and really said, we are not going to take unnecessary risk, and we're going to keep those frontline workers as absolute safe as possible. And quite frankly, that was just limiting the number of people that we even let around those employees, so that to keep them, again, we know social distancing, washing hands, sanitizing areas, wearing masks, all of those low-tech things are some of the best things to combat this virus. So that's the communication, and using, again, that chief medical officer for us has just been key. I call him my secret weapon, because he's been wonderful to go out and meet with our employees and give them all the information that they can be safe.
Thank you, Ola. So now we understand Heather's comment earlier about why her firm is so busy. You've heard communication, communication, communication. And
Yes.
so Heather, as a leader in a smaller firm, what has been your greatest challenge regarding women in the workplace due to working remote, and what has been effective in addressing it? In your situation, I think it's particularly unique because you know everyone who's at your firm, right? So if you could share a little bit about this, that would be wonderful.
Absolutely. It is different. So our team is 27 people. So I am able to interact with each individual person and understand kind of their personal situation, and make sure that we were trying to be as supportive for the individual as we could be. Like I said at the beginning, almost all of our employees are women. So that's also a little bit of a unique situation given the makeup of our workforce. So the first piece was the parenting piece. We told our parents that they could adjust their schedules as needed. So it's hard trying to figure out how to work from home and parent your children or school your children. So we, have design your day as one of our house rules to begin with. So we have a pretty flexible work arrangement anyway. We don't tell people that they need to be kind of tied to their desks between the hours of 9 to 5. And this took that to the extreme, I think. So one of my directors and her husband divided the day when they were both working from home. So she would work from 6 in the morning until noon. While he was with the kids, then they would reverse. She would be with the kids, and then she'd sign back on at night if they needed to. And then, sometimes it would be reversed. She'd have the kids in the morning and then work in the afternoon. We know even during non-pandemic times, we know how important flexible work schedules are for retaining women and women with children in the workforce. And I think during COVID, that's been especially critical to help our moms and dads to support their kids at home and still feel like they were contributing to their work, but doing it in a way that really met their situation. We also had a dad on our team take 10 weeks of paternity leave, right, as all of this was happening. So that was another sort of interesting challenge for us to navigate. One of the trends that we noticed is that across the board, everybody on our team was canceling their vacation time. I mean, where are we going to go, right? Nobody was taking normal vacation time, but especially, in March and April, I counted at one point we were working on crisis communication strategies and execution for 30 different clients at the same time. That's a lot of urgent crisis communication needs to be navigating. And so our team had this high degree of urgency and needing to move fast, and everything felt important. But then at the same time, they weren't taking the time to really disconnect and recharge their batteries. So we've done a couple different things for that. So we implemented mandatory self-care days where you didn't need to take a vacation day. You didn't have to have any big plan, but we've done now 2 rounds of this. The first time we just assigned you a day where you were taking the day off. And then the second time we let them sign up for a day so they could pick what day to take out of the office. We also are providing a self-care stipend. So every employee on our team can expense up to $100 a quarter, and they can use that for meditation, therapy, gym, virtual gym classes, whatever they want for their own self-care and mental well-being. They have an extra stipend that they can use. And I think that that's been helpful. The other, I think, important lesson I've learned is to meet the people where they are. Everyone experiences COVID differently, and that's okay. And we tried to reiterate that to our team. So we have some extroverts who are living by themselves in small apartments, and they're really struggling with not being able to get out of their house and interact with people. We've got, parents who are dealing with that. We have other people who are high risk factors and are taking social distancing very seriously. Other people are struggling kind of just to navigate the shifting priorities and urgent needs. And so as a leadership team, we've been making sure that we're frequently checking in on the individuals and providing the resources and support that they need. And that has worked for a company our size, where we've got some things that are available to everybody, but then we can also drill down into smaller groups or individuals to make sure we're giving them the support and resources that they need.
Yeah. It has been interesting. One of the things that we had to do when we looked at our paid time off usage is that our associates were so committed to getting the work done that they weren't taking their time off. And, we were going back saying, you need to give yourself a mental break. Because that's one of the disadvantages, is that when work is with you all day, you're always working, and you do have to give them permission or to encourage them to take the time for themselves. I don't know if you experienced that, Ola, as well.
I did, Gail, and I will tell you, we were in the midst of this crisis trying to help providers and hospital systems get the necessary supplies. And I never thought I would have to do this, but we were out talking to our associates about taking time. And what we heard was, but you're not taking time. So Mike Kaufman, myself, and even other members of the executive team, we've started announcing that we're taking time off.
Yes.
And so, walking the walk, so to speak. So, we even have had some things on Yammer where, I had my group of associates say, send pictures from your vacation. I'm like, I don't know that I want to show you in shorts at the lake or anything, but Mike skipped his weekly podcast on the Friday of the week that he was taking vacation. So making sure that your leadership are modeling behaviors, I think, is so important during this crisis as well, especially when you're trying to get people to take care of themselves.
We've had
Ladies, I'm so glad that you mentioned that, because, being that model of leadership goes a long way when people see that you are walking that talk. And Heather, you started to say something.
I was just going to reiterate that we as a leadership team have been very, this is when I'm taking my day. And we've also, on Instagram, we've been resharing, as our team has been taking time off and sharing on their Instagram stories how they're using their self-care day. We're resharing that content on our own company stories, just to reiterate that it is an important thing to do. And we want to make sure we're recognizing that all of our employees can do it, and then hopefully also inspire other businesses to make sure that they're looking out for their employees' well-being. It's a hard time right now, and people do need that time off.
Yeah. The other one you said that I just wanted to add to is really around that mental well-being. We started a Wednesday wellness, and where it was really focused on reminding people that, hey, this is a stressful time, and that, we all just sort of react and respond, but let's think about what you need to do to recharge and to, make sure that you can live through this. Put some oxygen on yourself first.
Yeah, we do.
Absolutely.
We send an email every Wednesday morning to our team with 5 resources or so. Maybe it's a podcast or a meme or something of just sort of, take some time for yourself. Here's something funny or inspirational, just a little sort of midweek checkpoint.
Yeah.
So ladies, the reality is the world is going through 2 pandemics. And many of you had mentioned this in your opening comments. Right now, we are sitting with the reality of the Black Lives Matter movement. We have been unearthing the realities of racial inequities and the treatment of Black people in our country. This, no doubt, is also part of the private sphere. What are your companies doing during COVID to keep diversity and inclusion at the forefront of your company and to cultivate a supportive environment where Black employees, especially Black women, are valued? And before you answer, I like to pose it to Gail and Heather. I think we all should be very proud that the city of Columbus and Franklin County both passed resolutions to declare racism as a public health crisis. So I think that's something that we can all be proud of. Gail, if you'd like to kick it off and Heather do that would be wonderful.
Yeah, I really would. I mean, I think that we're at an amazing moment in time. It's unfortunate that, you know, we had to witness, you know, the George Floyd and so many before him. But I think our country is really ready to really change and to lean into this, you know, all the way. I do want to say that, you know, one of the things that we do, we leverage at Nationwide is we leverage our associate resource groups. And we have we have 18 different groups, but we have an AWARE, which is African American Women Resource Group. And what I love about these ladies is that they are very comfortable speaking their truth. And what I do for how we create policies, how we respond to everything, even when we responded to everything that happened, we immediately connected with with all of our ARGs, because this is something where everyone has to be together as we make change. But so we leverage our ARGs, and what I really want to say is what I think every corporation is going to have to do is to do one of three things. They're going to either have to commit if they haven't committed in the past, as they look at what they're doing in their organization, leveraging data. They're going to either have to recommit, because, you know, many of them already have policies, but now recommit even more and getting the data so they can understand just how far along they are on where they said they want to be. And then I think all of them are going to have to reimagine something very different. You know, and I think that for me, in terms of ensuring that we are rebuilding equitably, is that, you know, it's all about the information and the data. You've got to first know, what does your workforce look like? And you've got to be honest about it and make plans to change it. As it relates to women and minorities, you've got to look at your paid time off and policies to ensure that it does not discriminate or keep them from staying. I think you've got to look at your benefits and all of those things to ensure that your workplace is a place where they can be successful and not worry about life. Recruitment, I think all of those things are going to be really, really critical as we begin to look at how do we rebuild a workplace that's equitable for all.
Hey, Gail, if I can just weigh in on a couple of things that you said that I think is so important. And for those of us who are in HR, I think we're at a pivotal point. And I've already said to my team, we are not going to be defensive. We're going to listen, we're going to learn, and then we're going to act. And so that's what we've been out doing with our African American community, because it's all the things that Gail said, but it's also your performance management systems, your succession plans. It's everything. Where does unconscious bias live in your organizations? And it's not just bringing a consultant in to dig around. Just talk to your employees, talk about their own experiences, listen to those employees. We've done some listening sessions as well with our African American community, but also our non-African American community, to really understand the experience of being a Black American, both outside the walls of your corporation, but also inside the walls of your corporation. So now is the time to listen and learn so that we can act accordingly and really make meaningful change. And I'm with you, Barb. I'm so proud of the city and all three of these organizations represented at this webcast today, because we are committed to making a change in our communities.
But it's really back to, as I said, I mean, I think every organization really has to look at, because every organization has a D&I policy somewhere. They got to go back and look at that policy and say, am I living into that policy? You know, and the only way you can do that is to really do the analysis of what says that you're really living it. And that is back to what I said, is what does your workplace, I always go back to this. If you do not have minorities and women represented in your C-suite, your boards, and throughout your organization, you're not committed to diversity and inclusion. If you do not have benefits and policies that make it easy for women to have jobs in your workplace, you're not committed to it. If you do not have programs that help advance women and give them an equal playing field, you're not committed. So, and you do have to listen. You talked about that, but you know, we leverage the ARGs constantly. And one of the ones that we just something new we added this year as a result of everything that was going on, in addition to our ARGs, we are tapping into a task force that we named a cross-section of leaders from across our country who will be looking at 4 different streams of work and coming back and giving us recommendations within 90 days on what else we can do to be a force for good, not only externally, but internally. So again, it's back to that listening and hearing the voice of the associate. But more importantly, it's back to whether or not you're committed to it or whether or not you're going to recommit to being a force for good.
Thank you, Gail. Heather, something to share?
Yeah, so our perspective, we're such a small company, so we don't have all these different employee resource groups. So we had to sort of tackle this a couple of different ways. So first thought about it at the individual level, how do we make sure we're providing support to the individuals? So for example, one story, our team, part of our work is providing social media services for a wide range of companies, including large brands like Walgreens and Donato's, and then more local brands like a Wolf Ridge or Columbus Marathon. And I had this really fantastic conversation with one of our community managers whose job is to be online all day, every day, and people post terrible things online. And I reached out to her personally. She's a woman of color. I reached out personally to her to check in, make sure that she knew that we were here. And I told her that no one should ever be subjected to that kind of hate and racism that we're seeing online, but especially not because of their job. So I made it very clear to her that if she needed to skip some of her community management shifts or she needed to spend some time offline, that we fully supported her decision that her mental well-being and self-care was more important, and I can get other people to jump in on the client work if needed. And I just wanted to open up that dialogue and make sure she felt like it was a safe, open space where she could feel comfortable saying what it was that she needed and know that she had the support of us there. And then as a company, then we did a few things sort of on that idea of learning and acting, and then funding was the other part. So I think, before we can act, we need to learn. And so we offered to buy books like, so you want to talk about race or just mercy or how to be anti-racist. For anybody on the team, we would buy whatever those books were that they wanted if they were committed to doing the learning. Then, we believe in movements and nonprofits can't operate without funding. So we made donations to the Columbus Freedom Fund, Surge, Campaign Zero, and the YWCA here in Columbus, and then also made a match. So identified, I think, 5 organizations, and then any of the bail funds in the cities where they're seeing big protests, we matched employees' donations also to those organizations. And then we as a leadership team are doing a deep dive into our own DEI efforts. What can we be doing to recruit more people of color? We're looking at changing how we do holidays. So I think, Juneteenth was a holiday that not a lot of companies gave off to employees before this year. And then there was a big rush of companies giving that day off. For us, instead of rushing to jump on the Juneteenth bandwagon, what we've decided to do instead is look at how do we make sure the holidays we're offering are more inclusive as a whole. So if someone is Muslim, we're not, that's not one of the days that is sort of our normal, the days that they may want to take off are not the days necessarily that we always take off. So making sure that our holiday calendar as a whole is more inclusive also. But just looking at, how are we making sure we're creating that environment to support diversity? And as much as we're focused on how do we make change on those systemic external issues, making sure that we're also looking internally and doing the work that we need to be doing.
Ladies, thank you for those responses. What I loved about hearing your responses is that literally each one of you walked through the 4 steps of the Columbus commitment. Understand, analyze, act, and share. So, this is a living example that there is a roadmap for how to do this. So thank you for that. I would like to swing back to Ola on a topic that we touched upon earlier, but I think really deserves having a little bit more discussion around, and that is the topic of mental health. Many people are fully aware that in times of natural disasters and disasters, the stats on domestic violence increases. Violence in general increases. The stress on people and the emotional toll increases. We went from 3 months of quarantine to the protest and racial tensions. Ola, what are some of the strategies that you'd like to share in addition to the ones that you mentioned earlier to support your employees' mental health? And for those companies that may be on the line today that maybe aren't sold on offering any programs to help employees with mental health, any EAP programs. Do you have any stats that you're willing to share that can help maybe nudge them over the edge to act in that regard, please?
Absolutely. So let me tell you just a really quick, brief story to set this up to let you know how I think important this topic is. And this is a real life happened to Ola situation. So I was out on social media. I live in Powell, Ohio, and out on the Powell bubble, there was an exchange where someone in my neighborhood that I kind of know said some really, really ugly things about not race, but about a person with disabilities. And so I sent them a private message and said, do me a favor. You don't know me. You don't have to listen to me. You can tell me to go jump in the lake. But you need to take down your comments because someone is going to send those comments to your employer and they're going to have to make a decision about you that you probably don't want them to make. And he wrote me back and almost surprisingly thanked me. But what he told me was that he had a drinking problem because of COVID and all the stresses that were happening to him, and that it was a wake-up call for him, and that he had to admit that he had a problem. And the night before, when you wrote those terribly ugly things about an individual, that he had been drinking too much. And boy, did that just break my heart. So back to your point, I pointed him to his employer's EAP because I know they have a wonderful EAP. And I talked about taking the stigma out of mental health because I think that's all what we're talking about. Ask for help. But I knew him enough to know that wasn't the person, that something was going on. So when you think about stats, Barb, we know that that Americans are reporting 50% they're feeling more stressed than that they were. And if back to what Gail said, we study our data a lot at our own companies, as well as understanding how we benchmark. And we know that mental health is one of our top healthcare costs out there. So that's even before COVID. So it's an epidemic in our organizations, in our country, in our world, quite frankly, because it is a global epidemic. So if you think it's not happening at your organizations, it is. Whether it's just happening and it's impacting your healthcare spend, but most importantly, it's impacting your people. So we all want our employees to be able to bring their best. And we feel at Cardinal Health that taking the stigma out of mental health is absolutely the right thing to do, and help not only encourage, but to educate our management team on how to talk about mental health and how to give our employees the support. So look, this is one that I'm not afraid to admit that we have partnered with Nationwide quite a bit to learn from them, because they've been doing this for years really, really well. And I get to partner with Nationwide as well on many things. But as you know, we have been partnering on substance abuse and the opioid epidemic through the state of Ohio, and Nationwide has been a leader in theirs as well. But we launched something called Mind Matters, and we have also upped our mental health resources. So like Gail, we have partnered with our employee resource groups one by one, getting the word out about mental health. They all have a little bit different needs. If you think about veterans versus LGBTQ, and now African Americans that are tired and exhausted through this situation. So we have webcast, we have our healthcare partner that is helping us along. We increased our benefits like Headspace. We have seen a 74% increase in our Headspace app, and lots of other resources out there. So I will tell you, first, you've got to talk about it. Your employees have to know that they have a place to go. It's not just about increasing your benefits. I think that's important. We upped our EAP, did a lot of great things, but we have got to take this stigma out of mental health. Because and talk about it. It's almost like racial and social injustice. We've got to be able to have those difficult conversations and make people feel okay. It's funny, you know, very early on, one of the podcasts that I did, I talked about all the things that were worrying me and keeping me up at night or sending me to bed early in the morning. And I talked about really silly things like, what is my hair going to look like in another 6 weeks? To my kids have anxiety
that is not
about
silly at all, Ola.
I know. It felt silly to say though, Gail, but and I also shared to say I have a kid that's thriving and I have a kid that's not thriving. And so I think again, we talk about modeling behavior. I think it's okay if I can talk about all the struggles that my family are going through and talk about how I'm getting help. And it just, that's what I think we all have to do when it comes to mental health. And, whether it's how you do that, a big company, a small company, but we have to face the fact that this is, again, shining that ugly light on something that already was there. It's just increasing it even more for our employees. So sorry to start with that rambling little story, but for me, it was a perfect example of all the things that people are struggling with and how it's impacting them and how we've got to get those employees help.
Yeah.
So can I do a follow-up, Gail, as you respond, can you address potential HIPAA concerns? We had a question come in around HIPAA. I mean, how do you address mental health and also be cognizant of HIPAA?
Well, again, they're separated. You can address mental health at a general level without talking about an individual situation. So I think Ola talked a lot about, EAP very much nationwide did the same thing. I mean, we want our associates, we increase the number of visits they can have and a family member can have. But what you do is that, and this is where data is so important, and leveraging your mental health professionals to say, what are the things that people are experiencing right now? And so you bring general presentations in. That's not a HIPAA related issue. And if they use EAP, we have no idea who's using it. What we want to do is to make it safe for them to use. And so one of the things that I just want to add that for different organizations to consider. So what we understood the importance of leadership, that leadership matters. Ola just used that example. And what we do is we do this Monday, it's like a mental health Monday where we leverage our senior leaders to do an exercise where they talk a little bit about how they're feeling, how they're responding to it, and then to practice some kind of breathing exercise because we know how important that is. But imagine having the CEO talk about how he's managing the stress and what he's doing to manage through the stress, and having your CFO and different ones do it. And then being vulnerable enough to practice doing deep breathing online. So again, it's really back to being vulnerable and letting people know that we all are dealing with things and we're okay. Like everything, you just go and figure out how to get it solved.
One thing that we did that I think our team found helpful, when you give employees here's all the benefits that are included in your benefits plan, it can feel overwhelming. Sometimes it's hard to know exactly what they have access to and they don't. So at the beginning of this, we had our operations manager pull out what are the telemedicine benefits, what are the mental health benefits, and we created just a one-pager that was like a quick reference guide for people to know, in this unique moment in time, what benefits were available that maybe they didn't know about or they weren't sure how to access. And our team really appreciated that it was just a quick, handy reference so they didn't have to sift through all the paperwork that comes when you're onboarding for your benefits program.
That's an excellent idea, especially in a time where there's so much information coming at people. Great suggestion. And so ladies, earlier Heather mentioned a perfect example of how one family is balancing homeschooling, working from home. Let's talk a little bit more about the caretaking role. We know that the onus and the burden tends to be on women to take care of elderly parents, children, and that's true even when both parents work outside the home. This is especially true when children are young. Among the full-time employed married men provide 7.2 hours of childcare per week versus 10.3 for women. In other words, women take on about 60% of the childcare while also working full-time. When focusing on childcare during work hours, this number increases to about 70%. And this is before COVID-19 outbreak. With COVID-19 and children at home, many elder care services are on hold, and this double role has been amplified for women. What are some of the strategies that you have put in place to support women taking on the extra role? And then also, do you see men taking advantage of the support offered and understand the value and necessity of having the support structure in place? And I'd like to throw it out there to all three of you. And first one who'd like to respond, go ahead.
Well, I'll start. I mean, again, I have seen men becoming more involved with childcare and support, especially during this time. So, you know, one of the side benefits, at least anecdotally, that I believe has occurred, I think, of COVID is that I think families have gotten closer. Now, again, there are some where, again, you know, you've seen some other challenges, but I do hear for the most part that families are getting closer and are trying to figure out how they can work together. But for us, what we did is we created a number of COVID-19 related portals with tools and resources to support our associates. Again, we've already talked about offering the mental health services and the virtual doctor visits, because again, you think about the parents with children. So that's when Teledoc became, I mean, it has just taken off big time. And we encouraged it in every weekly communication. We talked about that. So imagine having small children and worrying about how to get them to the doctor. So we looked at that. You know, we looked at additional benefits adjustments we created a COVID pandemic policy before the CARES Act, before anything came out, that basically supported our parents who had childcare issues they needed to take care of. So again, what we did is we have a mom's ARG. And so what we did is we leveraged our mom's ARG to say, what do you need to help be successful during this time? We encourage them to stay connected to one another, to be a resource for one another. So again, it's really back to listening to groups who represent the masses, and then it's providing information, resources, tools, and it's back to pulse surveys to say, how are you feeling? What can we do to help you be successful? So that's what we did.
Thank you. Ola or Heather? I think you're on mute, Ola.
I'm sorry. I'll add just a couple of things that we did in addition to what Gail talked about. So one of the things that we did was we changed up our emergency childcare just a bit. So we allowed you to pick your own provider, and then we worked with the provider to get them in the network so that we could have those emergencies as well, or those visits as well. But one of the things that we did, again, setting the context really early, was we knew that we needed to come up with a commitment around this, as Gail talked about. So for us, it was 10 things that all of our employees committed to, because again, we had some going to work and some not going to work. But some of those were just as simple as, I commit to putting my family first. I commit to setting boundaries and maintaining balance. I commit to checking in on my employees and staying connected to them. And the obvious business things like being a trusted partner and living our values. But again, this goes back to modeling that. It was also, quite frankly, a little push for our men to realize that we were at a balance between what men were doing and women were doing at home. So we wanted our men to understand, as well as our women, that they needed to support their families as well. So again, Mike and I went out and talked about these values and this commitment, and why it was so important in this pandemic to think about the work and not necessarily when the work gets done. So we have kind of 50-minute meetings now instead of 60-minute meetings, so that people are taking those breaks that they can just get up and walk around the block or the kitchen or eat, because we knew that people weren't eating on a regular basis or the schedules. So just continuously talking and giving employees information, like Gail said, was I think key to this one as well.
It was the trust. I mean, it was just, how do you build trust? And the only way you build trust is listen, and respond.
Yes. So Heather, there was something that you mentioned earlier. We've been talking almost about, married couples for the most part. Let's think about the single parent. Any suggestions around, there isn't a spouse, that they can delegate to or partner with? Suggestions? Anything come to mind?
I think that's where the flexibility really comes into play, and recognizing that not every family situation looks the same, and some family situations are, mom, dad, same house, and then there are other family situations that are just very complex, and especially in the age of social distancing, some people may have created sort of pods with other families so they can provide support. Other families don't have that type of support. So I think that's just where that flexibility goes in, and trusting your people. I think, what I tell our team all the time is I trust that I've hired really smart, dependable people, and we shouldn't have to micromanage them. That if I get out of their way, they're going to get the job done, and I don't need to know or see them, necessarily doing it between the hours of 9 to 5. If it's easier for them to do it super early in the morning or later at night after their kids go to bed, that's okay too. You have to have that trust going both ways. As much as we want our team to trust us, it's also really important that we trust them and empower them to do their work, and then create the flexibility as much as possible so that they can get everything done that needs to get done in a way that's conducive for whatever their home situation may look like right now. The other piece that we have is reminding people that nobody's functioning at 100% right now. And so, I think everyone's trying to be the best employer and the best mom and the best dad that they can be. And we all just need to show ourselves some grace. And we have this conversation a lot with our team internally that it's okay if you're not operating at peak productivity right now. And it's okay. My son is sitting on the couch right now watching a show. I normally don't really let him watch a lot of TV during the day, but I knew I had to do the webinar and didn't want him running in here asking hey, what's for lunch? So he's watching a show. So is it awesome parenting to plop him down and watch Netflix? Maybe not, but it's also the reality of what just needed to happen today, and that's okay.
Thank you, Heather. We had a question come in for Ola. How can my child care company be included as an emergency child care provider for your company? We have someone who owns a child care company, and they want to know how they can be considered an emergency child care provider.
So we work with a vendor called Bright Horizons, which I think most organizations, or a lot of organizations, big and small, work with. So that is, we actually work through Bright Horizons and through their network. So I would get in touch with them, because we don't choose those individually.
Okay, thank you.
Gail, are you in the same with Bright Horizons?
Yes, we use Bright Horizon as well, Ola.
Yeah.
Okay.
It's a great organization that you can get hooked up with.
And they have been amazing during this pandemic. Amazing partners.
Amazing, flexible, and again, they're looking for some partners, I'm sure, because I think it's, again, been a great opportunity for them to help organizations like us. I agree, Gail.
Thank you. We have fielded all the questions coming in thus far, but I do have 2 more questions that are kind of gonna round us out here. Obviously, between racism and COVID-19, these have been challenging times, and many organizations are finding themselves in the position of needing to rebuild. As organizations rebuild, what are some of the policies and practices that companies should be thinking about to establish themselves as gender equitable, both in the short term and the long term, and also to eliminate racial disparity? I mean, as companies are rebuilding, what are some of the opportunities they can take advantage of now?
Well, I think it goes back to what Gail said earlier, is you should know your numbers, not just from representation, but understand, are you paying people fairly and equitably compared to other women versus men? And then also, doing a study on race for the U.S. And so I think knowing what those disparities are and then acting on them is really important. But I think starting with understanding your data is probably key. And I'm sure the other ladies have some other things to act, but to add on to that. But I think that's where you have to at least is a good starting point if you don't do that already.
Well, you've heard me say this 100 times. I mean, Ola and Heather, you've heard me. I think we are all in agreement that, I mean, this work is not hard work. It's just really executing against it. And you can't execute against it if you haven't done the analysis. And so again, I think you have to know what I said this earlier. You have to know what your workforce look like and what your workforce should look like in the community or in the field in which you're working. You've got to understand your policies. And the other thing you have to do is, in my mind, is to leverage engagement, however you get information on how your associates are feeling, so that you can then segment it to understand, how do women feel? How do minorities feel? How do majorities feel? Because the more information you have, the more you can create strategies to ensure that you're addressing it. So again, I think all of the policies are the same. You want an environment where everyone can do their best work and it's neutral. But if you don't have a way of measuring it, you won't get to that outcome.
The other piece I would add is a plug for paid family leave. Paid leave shouldn't be just luck of the draw if you happen to have a boss who figures out how to self-fund it, and it shouldn't only be available during a pandemic. Somehow we managed to figure out how to give even hourly and essential workers access to paid time off at the beginning of this pandemic. That should be a right that all American employees have access to. It's smart for business and smart for communities, and there are still far too many Americans who don't have access.
I so agree with you, Heather. I so agree, because I'm always, and Ola and I are looking at it from a big company perspective. And if we're going to compete, we have to have paid leave. But we talked about this earlier, is that when you think about essential workers being people who work in the hoteling business, the retailing business, they don't often have that. So I think that is one that organizations and companies need to look at, how they can provide it.
Ladies, thank you so much. For those in the room today who are learning from your vulnerability and hard work, what is that one piece of advice or unexpected challenge that you'd like to share? What has been your greatest success in how your companies have supported your employees through COVID? At the end of the day, when you look back on these last 3 months that feel like a year, what do you hang your hat on and say, I'm proud that we did that? Or what was that one unexpected challenge that you're still trying to figure out the right solution to, or the best solution? Who'd like to go first?
Who's going first? Heather.
Heather, go ahead.
Sure. So I think it's a good opportunity for all of us to remember that just because that's the way it's always been done doesn't mean that's actually the best way for it to be done. So I think in the last 3 or 4 months, we've seen outdated workplace policies just get upended. So from paid leave to remote working to flexible schedules, all of these kind of workplace policies that were put in place 40, 50 years ago aren't working for workers right now, and they're not working for businesses right now. So I think, I hope as we sort of, as the economy starts to open up and, people start to think about going back into the office again, that we don't just that we don't default back to what business used to look like, and that we take some of these lessons that we've learned and carry them forward so that we can embrace technology to create more inclusive, flexible environments that do support women and people of color, and that we're pushing ourselves to meet those innovative workplace policies so that we can better meet the needs of today's employees and employers.
Thank you, Gail.
Yeah, so for me on that one, you've heard me talk constantly about communicate. Leadership matters. I mean, but I really think the one I want to talk about is really that seize the opportunity to reimagine, and it sort of builds on what Heather has said. I mean, COVID presented all of us with opportunities to open doors that in some cases have been previously closed, with leaders who couldn't envision having people work remote, or to accelerate remote work, or to accelerate your digital transformation. And so to me, it gave us the opportunity to reimagine. And as a result, we're reimagining everything. We're looking at everything to say, if why not? And why did it take us so long to make a decision pre-COVID, and now we're making decision on a dime? So to me, that was a big one. And the other one I want to just call on is really about winning the day. And that is that each day, at the end of each day, especially when we were in the heart of COVID, it was to focus on one thing that we were really proud of, that we needed to get done in order to ensure the safety of our associates and that we could continue to deliver on our promise to our members. And so we would celebrate that. We would talk about, hey, what did we learn today? How do we celebrate that we got that done? So those are, sorry, more than one, but I had to talk about them.
Thank you, Gail. And Ola, you want to close it out for us on this question?
I sure will. I'll just add a couple of things. I think the decision making and the innovation was key for us, right? I think we've all learned about how quickly that we can make decisions when we need to. Two quick thoughts. One is I learned really early in this pandemic to say, stop saying we're not going to do that, right? Because I said it a lot and then put my size 7 foot in my mouth a few times because we did have to do many of those things. But I heard something, and I stole this from someone or on social media, but if we all look at 2020, because it's been hard, right? This pandemic, social and racial injustice, but kind of made a paradigm in my mind to say this is the year we can learn something and we can change how we think about our society, our country, and even our organizations. But if we look at it of not being that dreadful year for us as Americans and really think it's the year that we finally learned something, I think we can all go into this maybe with a different head and heart combined. So that's what we're trying to do, at least at Cardinal.
Ola, those are excellent closing comments. Ladies, what a phenomenal panel and resource of information that the three of you have been today. We are grateful for your service and your leadership in the community. The mission of my organization is to get more women at the top of organizations and in leadership role, and you all are a testament of why this is so important. So thank you for all that you do to make Columbus a great place to live and work for all. It's been wonderful being with you on the Columbus Women's Commission. Many thanks to Shelley Biding for helping get this organized, and also many thanks to First Lady Shannon Ginther. Thank you, everyone, and enjoy the rest of your day.
Thank you.
Bye, everyone. Thank you.
Bye, guys.
Thank you.
Bye, Ola. Bye, Heather.
Bye, Heather. Bye, Gail.
Bye. Bye, guys.